Welcome to the deep dive. We take your sources, break them down, and pull out the key insights for you.
That's the plan.
Today, we've got this material. It looks like a pretty thorough guide, really aimed at nurse practitioners in vascular surgery.
Yeah, it seems really tailored for NPs. So think of this as our quick look at what's inside and why it might be, a really valuable tool if you're working in vascular care.
Right, getting into the practical stuff.
Exactly. Let's unpack it.
Okay, so where does it start? Looks like it kicks off with the fundamentals, evidence-based practice, EBP.
Right. Straight in with defining it, bringing together the best evidence, your own clinical know-how, and importantly, what the patient values.
That integration piece.
Yeah. And it doesn't just stop at the definition. It actually lays out the systematic steps.
Like how to actually do it.
Precisely.
Yeah.
From forming that clinical question right through to appraising the evidence you find using that hierarchy.
Ah, the pyramid. Systematic reviews at the top.
Exactly. Meta-analyses, systematic reviews, all the way down to expert opinion. It sets the stage for how you should be making decisions.
Got it. Okay, so after the how-to, it moves into diagnostics, vascular diagnostic studies.
Yep. Covers quite a range, both invasive and non-invasive.
Let's talk non-invasive first, like duplex ultrasound. That's a big one.
Huge. And it goes beyond just saying rule out DVT. It talks about actually visualizing the thrombus, assessing blood flow, and crucially grading stenosis using velocities.
Okay, so quite detailed.
Very. And what's really useful, especially for NPs, is how it connects these tests to nursing implications.
Ah, so not just the tech side.
No, it's about your role, patient prep, what to monitor during and after the test, and how to make sense of the findings. It ties it all together.
Makes sense. What else on the non-invasive side? ABI?
Yep, Ankle-Brachial Index, segmental pressures, assessing arterial disease. It even mentions the exercise testing protocols, like on the treadmill.
Okay. Toe pressures too, and plethysmography.
Those are in there as well. Then you've got the more advanced imaging, CTA, CT angiography.
Good for anatomy, right? Arterial wall.
Exactly. Really detailed views, great for things like staging aneurysms and MRA, magnetic resonance angiography.
Non-invasive uses magnets.
Right. Good for laminar flow, but it notes that turbulence can sometimes, look like disease, so something to be aware of.
And invasive. Briefly.
It touches on arteriography, explains the purpose, the Seldinger technique, but also flags potential complications NPs need to watch for arterial injury, distal emboli.
Again, connecting it back to nursing assessment.
Always. It seems to be a core theme.
Okay, so from how we find things to what we find, vascular conditions looks like a wide range.
It is. Let's start with arterial diseases. PED, peripheral artery disease, is obviously key.
Risk factor: smoking, diabetes, high blood pressure.
All the usual suspects. But it also details symptoms like claudication, rest pain, and gets into exercise therapy, comparing supervised versus home programs, even arm ergometry.
Interesting. What about more acute stuff?
Acute arterial occlusion. Big focus on that sudden perfusion loss, risk of limb loss.
So,
Very critical.
and AAAs, abdominal aortic aneurysms.
Yep. Covers risk factors, those size guidelines for repair, like the standard 5.5 centimeters, but noting it might be lower for women.
Oh, that's important.
Definitely. And complications post-EVR, like endoleaks. Key surveillance points for an MP managing these patients.
It also mentions Berger disease.
That inflammation of small and medium vessels, really emphasizing the strong link to tobacco.
Almost exclusively tobacco, right?
Pretty much. And Raynaud's, too, the vasospasm, cold triggers, distinguishing primary versus secondary causes.
Okay, shifting gears to venous diseases.
Right.
DVT and superficial thrombophlebitis.
Right. Covers Virchow's triad, risk factors like trauma, IV lines, hormones like birth control pills.
Diagnosis via duplex again?
Yep. And management anticoagulation, gets into heparin, LMWH dosing, monitoring, even the newer oral agents.
And the big complication, PE, pulmonary embolism.
Major focus. Risk factors, symptoms, diagnosis. It even points out the limitations of D-dimer sometimes. And then management strategies.
What about chronic venous issues, ulcers?
Yeah, chronic venous disease and venous ulcers. Explains the pathophysiology, what to look for edema, skin changes like stasis dermatitis, lipodermatosclerosis.
And management. Compression.
Absolutely central. Highlights compression therapy as key alongside wound care principles. Really practical stuff.
The guide seems to cover lymphedema as well.
It does. Primary versus secondary causes, post-surgery, radiation, infection. Assessment stuff like measuring limbs, the Stemmer sign,
And management?
the mainstays, compression bandaging, garments, MLD, manual lymphatic drainage, and pneumatic pumps.
It even addresses amputation.
Yes. Covers why it happens, PAD, diabetic foot issues being major causes, how the level is chosen, and then the rehab consideration.
Like prosthetic fitting, phantom pain.
Exactly. Factors influencing fitting, managing phantom limb pain, things NPs absolutely deal with.
And finally, vascular access.
Covers the types fistulas, grafts, central lines, and importantly, the potential complications. Thrombosis, infection, bleeding, things you're monitoring constantly.
So across everything, there's this consistent thread of risk factor management.
Absolutely. Hypertension, lipids, diabetes, and a big emphasis on smoking cessation.
And patient education.
Woven throughout. It constantly links treatment back to lifestyle changes, self-care, empowering the patient. That seems like a huge focus for the NP role, according to this guide.
It really feels like this resource is designed to equip NPs with very specific practical knowledge. It connects the dots between the complex pathology and diagnostics and the day-to-day nursing assessment and interventions.
Yeah, it's bridging that gap, providing the why behind the what you do.
It seems like a really solid overview, linking the science directly to the hands-on care NPs provide.
Definitely appears comprehensive for that audience.
So the final thought for you listening, as you integrate this kind of detailed information, how does really understanding the why, the pathophysiology, the diagnostic nuances, how does that empower you to provide even more precise, maybe more confident care for your vascular patients?